Hi, everybody, and welcome to our webinar today. Climate Change Across the Life Course, Evidence to Action. We're launching a call of action by WHO, UNICEF, and UNFPA, as well as an advocacy brief by PMNCH and partners. I'm Doris Chu from the WHO, and I'm pleased to welcome you all to this webinar on behalf of my colleagues here in the room and WHO, UNICEF, and UNFPA colleagues from afar. Dr. Nira will be joining us very shortly, but in the meantime, to get us warmed up, we have a short video for you to see. Over to you, Caroline. Thank you for sharing that video with the group. We have the pleasure and the great honor to have His Excellency, the Minister of Health from Equatorial Guinea, who will share some thoughts with us on what climate change has meant to him and his country. Over to you, Honorable Minister.
Thank you very much, distinguished guests, fellow health advocates, and esteemed colleagues. I'm very humbled to take part on this important discussion on the impact of climate change on the inhabitants of our beautiful planet and in the health and well-being status of all of us. Climate change is not for us merely an environmental issue. We see this as an unprecedented crisis of threatening and magnitude. The escalating of climate crisis has exacerbated the burden of mortality and mortality, particularly in developing nations like Equatorial Guinea. We are currently witnessing a surge on emerging and re-emerging diseases, such as dengue, fever, malaria, and typhoid, as well as the rise of respiratory illness like asthma. We believe that climate change is a fertile breeding ground for disease and jeopardizing the health of women, newborn, and children, which are our most vulnerable populations. Therefore, I think to be able to tackle this issue of global proportion, it is very, very extremely important. I think that every advancement we have achieved on this effort over the past decade, we are risking the risk of losing all the progress, and it is urgent for all of us to take action and to join hands with the UNFPA, UNICEF, WHO, so that we can put together a global coalition, not only to continue to improve the objective that has been marked for the agenda, the WHO Agenda 2030, on the reduction of mother and newborn mortality rate, but also to continue pushing for the improvement and the ultimate fulfillment of that incredible and humane task, which is to save life. I think climate change has a huge burden on all of us, but especially on those groups. And this is an issue, the issue of the reduction of child and women and child mortality rate is something that is very dear in our heart. In Equatorial Guinea is almost a personal quest, because in the 21st century, we think that no one should be left behind in terms of achieving universal health care, and ultimately the change on the climate is a huge challenge for all of us, and we need to take action. And I'm very humble and happy to join on this conversation with you guys today. And I hope to have some fruitful and enriching conversation and contribution to this conversation. Thank you very much. Muchas gracias, Akiba.
Thank you, Your Excellency, for those very compelling words, and to hear your commitment to protecting maternal, newborn, and child health from the impacts of climate change. I'd like to go ahead and give some remarks on behalf of our colleagues before we pass to our colleagues at UNICEF and UNFPA. Just to set the stage, in just 1 week's time, the world's leaders are going to meet at COP28 to agree on how to address climate change. And this year's COP marks the conclusion of the first global stock take to assess progress under the Paris Agreement. The UN Climate Change Executive Secretary has already urged the world to carefully study the global stock take synthesis report. It is a report card of our collective climate action. And to be honest, it's not a good one. COP28 is our chance to make a dramatic course correction. Let's seize that chance, and I'll close that quote. It's clear. Climate change is one of the gravest threats facing humanity, affecting us all. Climate change is an obvious part of that discussion. Extreme weather events to climate change impact communities and the functioning of our health systems through the loss of physical infrastructure and threats to human resources. Loss of infrastructure prevents individuals and communities from withstanding the consequences of extreme heat, droughts, or flooding. But today, we're going to focus on women, newborn, and children, and would like to highlight that they face unique risks from different climate change hazards that affect their health and well-being. We see that health workers in affected communities face undue challenges in providing care while managing their own personal safety. Disruptions to basic healthcare services in rural and urban settings jeopardizes access and quality of maternal, newborn, and child health services, including sexual and reproductive health services. While pregnant women and their newborns experience extreme heat and other climate-related hazards, they may be at an increased risk for developing complications that lead to adverse maternal, perinatal, and neonatal outcomes that are life-threatening or have lasting implications throughout their entire lives. These include the major causes of maternal and neonatal morbidity and mortality. In addition to the health risks related to poor nutrition, water, hygiene, and sanitation, the effects of exposure to climate hazards and their aftermath during and after pregnancy can affect mental health and contribute to intergenerational trauma. Women and girls carry a disproportionate burden of the impacts of climate change. And since it contributes to the complex interplay of gender and social norms within homes and communities, we cannot ignore this. Emergencies caused by climate change, as well as financial and economic stress, also put women and children at increased risk of violence. In childhood and adolescence, extreme weather events such as floods and severe tropical storms can increase rates of depression and post-traumatic stress disorder in children and adolescents, with potentially long-lasting mental health impacts into childhood. Extreme temperatures, both hot and cold, poor air quality, negatively affect respiratory health in children. Combined with food insecurity, children are at a greater risk of malnutrition as well as increased mortality. With progress stalling on so many fronts, immediate action is needed to meet the goals of the Paris Agreement, as well as those of the Sustainable Development Goals, with a focus on women, newborn, and children. We believe that addressing the impact of climate change on health requires understanding what are the specific maternal, newborn, child health impacts, and that we work together as partners to find actions to protect women, children, and newborns. Today, we launched the UN Call for Action to protect maternal, newborn, and child health from the impacts of climate change, with 7 actions to take. These actions align with the WHO operational framework for climate resilient and low carbon health systems. First and foremost, we need to urgently address maternal, newborn, child health needs and vulnerabilities within the global climate response. And to do so, we need to leverage on the power of partnerships to advocate for the health and well-being of women, newborns, and children amidst the challenges posed by climate change and drive transformational change. To this end, we are happy to see that PMNCH, the Partnership for Maternal, Newborn, and Child Health, is also launching today an advocacy brief targeted to the various PMNCH stakeholders, from governments, global financing mechanisms, donors, private sector, civil society, to parliamentarians, on the steps that they take to foster collective efforts to address these pressing threats of climate change on women's, children's, and adolescents' health. Seeing partners step up in advocacy underscores the power of collaboration in driving meaningful impact. This year, COP28 will have its first Health Day on 3rd December, and the voices of the health community will be more powerful than ever. The voices of women, children, and adolescents are critical to advance this agenda. It is great to see partners such as PMNCH, the International Confederation of Midwives, the Early Childhood Development Action Network, the Wilson Center, and so many others stepping up collaboratively to drive this agenda. Together, we are building a strong foundation for transformative action, and we are confident that by working hand in hand, we can make significant strides in addressing and safeguarding the health of the most vulnerable women, children, and adolescents in the climate crisis. Now, we'll hear from our esteemed speakers about the impact of climate change and actions in place. First, I'd like to pass it to my colleagues from UNICEF and UNFPA. First, we have Abid Salama, who will give us some thoughts on what UNICEF is doing to address the impact of climate change on the health of children. Over to you, Abid.
Thank you, Doris. Can you hear me? Yeah, just to confirm. Sorry. Firstly, I would like to thank the WHO, UNFPA, PMNCH, and partners for the partnership in driving attention through this important call to action to talk about the intersection between climate change and maternal, newborn, and child health outcomes. We're all concerned because we risk eroding decades of progress here, which is exactly what the Honorable Minister also pointed us to. So at UNICEF, and I'm going to deep dive a little bit to some of the things that Doris talked about. At UNICEF, we say that children are uniquely vulnerable for several reasons. And when we say children, we mean across the life course, from pregnancy to adulthood. And if we talk about young children, particularly infants, they breathe more rapidly than adults while their lungs are still developing. And this puts them at a greater risk of developing respiratory illnesses when exposed to air pollution. This is why every day 1,000 newborns die simply because of air pollution related risks. The other thing is they are less able to than adults to regulate body temperatures and have a higher metabolism, meaning that they're more susceptible to the effects of extreme heat. We released a report about a year ago that came up with this data that 1 in 3 children are currently highly exposed to heat waves. And we hear it every year. We know that year after year, we are announcing that this was the hottest year on record or the hottest month on record. So we can imagine what it means for children. Then their immune systems, as we know, are not developed. Therefore, they may be unable to fight infections effectively. So we know the patterns of dengue, Zika, and malaria are changing. We also know that 80% of all global malaria deaths take place in children under the age of 5. So we are, of course, concerned from that angle as well. And then is the extreme weather events where children are particularly susceptible during and after disasters, as they're often more dependent on adults for care and protection during disasters and after, of course. Children accounted for, just talk about the Pakistan floods, children accounted for 1/3 of the total deaths during those floods. And then millions of children were later at risk, affected by infectious diseases, food insecurity, and unsafe water supplies. We know that children are uniquely at risk because they are rapidly developing and they eat and they drink more than adults compared to their body mass. We also know that when pregnant and lactating mothers are exposed to climate shocks and stresses, the negative effects not only affect their health, but also fetal development. The challenges facing children's lives and future are unprecedented. The call to action rightfully frames climate change as a health and human rights issue and demands a whole of society approach. We need to scale up disaster risk reduction strategies and strengthen climate resilient health systems and health determining sectors, that is food, wash, and social protection. UNICEF's Sustainability and Climate Action Plan outlines how UNICEF will contribute across these priorities. We also need new climate and health services on the front lines that protect maternal, newborn, and child health. To this end, we are working with WHO to roll out an e-learning course on children's environmental health for all health workers globally to protect children from climate change and pollution. This year, UNICEF has rolled out guidance and assets on protecting children from heat stress, which have been translated and adapted in some countries. Together with the UN Environmental Programme, UNEP, and the World Bank, we're putting together a global collaborative on children's environmental health. Through this, we are aiming for a major upgrade to the environmental health agenda from traditional wash and vector control challenges to also address climate change related risks, to address pollution, and also the built environment challenges that children face. We're engaging health workers, teachers, ECD caregivers to protect children from air pollution, heat stress, lead poisoning, road traffic accidents, and more, and working together to address the sources of these risks. I will share the link of this portal that we've just put. It's still in testing stage, but just because we have the partners today in this conversation, I will put the link in the chat box so you can see, and you're very welcome to join that and engage with us as we work to address these issues. Finally, we hope that with greater access to tools and financing, including through the newly approved Losses and Damages Fund, and under the global goal for adaptation, we will be able to scale up disaster risk reduction strategies, promote investments in the health, co-benefits of carbon emissions reduction, and build more equitable societies. Altogether, which will save the lives of children everywhere and help them stay on the path of achieving their fullest potential. I thank you.
Thanks so very much, Avit. And now may I pass to our colleague, Will Zeck from UNFPA. Over to you, Will.
Thank you, Doris, and thank you for organizing this webinar around this statement, which is so important. And we are so glad to see that UN agencies, WHO, UNICEF, UNFPA, but also PMNCH are part of this. It's so important that we join forces. As UNFPA, as the Sexual Reproductive Health Agency, we're very concerned about SRHR, of course, where maternal and newborn health is a big part of it. Across the life course. And I just wanted to point out that the climate crisis is really an emergency that brings out the inequities. Poor, vulnerable women and girls in risk countries are the ones who are most affected. And that goes into the life course and affects their newborns and their children. And so this displacement has really a heavy toll on those women. At the same time, those women and girls in the poorest countries are those who are contributing least to the climate crisis. And that's unfair. It's just inequalities that are emerging. And I just want to point to the gender inequalities that are caused by climate change and again affecting women and girls specifically. And so if we don't address gender inequality in the climate crisis and sexual reproductive health, we will not achieve our goals. Also want to point out that it's very important that you protect maternal newborn health along the life course in sexual reproductive health. And it is important that whenever we talk about climate change plans at national level, that we don't forget sexual reproductive health, that we don't forget the gender inequality aspect. And unfortunately, reviews that we have done in UNFPA are still showing that this is very often not the case, or sexual reproductive health, maternal newborn health is not being prioritized. And so I believe this statement is so crucial for bringing this up with our government counterparts. We also have to make sure that we get financing right, and we need more financing to commit to climate change and climate change adaptation. And here again, it's important that we gear up in terms of financing and have funding available for that. A few examples what UNFPA is currently doing and where we want to join forces with other partners. One of them is, as I was saying, influencing national action plans for climate adaptation. Here we focus a lot on health workforces, so doctors, midwives, community health workers. How can they influence climate change adaptation in their communities and in their environments? At the same time, we're also undertaking studies around climate change adaptation and sexual reproductive health and maternal newborn health. We're also looking at water insecurity, especially in emergency obstetric and newborn care service centers. We have developed a water index where we can map out where water is lacking, where there's not enough water in some healthcare facilities. Well, and what can we do about that? At the same time, you also all know the minimum initial service package for SRHR in crisis situations, the MISP. And also here we are have included climate change adaptation and action for tackling it. We also look at solar solutions, innovations, and in East Africa, we have recently launched a so-called Hack Lab, where we have invited young people to come up with innovations for climate change adaptation. And we received 111 applications, out of which 11 went into the boot camp. And interestingly, there was an innovation coming up where lab technicians would use solar and electrically powered motorcycles to go around and do lab tests in their communities. So it is a small project that can have a really big impact in communities in low and middle income countries. And finally, and I want to point this out, it's very often forgotten, but climate change can cause also mental health stress for families, for mothers, for their newborns. And as we know, and as Abid was saying, there is a major impact on the newborns and on children. And it's all about the life course approach. If mothers are stressed, the children cannot flourish and their families cannot have a normal life. So we have to also address the mental health component. We're trying that in terms of making sure that mothers who are affected by climate change health-wise, but also by other constraints, that they are mentally well and can thrive as they support their families. So that's from UNFPA side. I thank you, and I really want to stress how happy we are about this statement and how happy we are to see all our UN sister agencies. I think together we can make a big change with this. Thank you, Doris.
Thank you so much, Will. And thanks again to both you and Abid for this collaboration. As you say, working together as sister agencies, we really have a chance to really change the landscape of maternal newborn child health when it comes to the impacts of climate change and the discourse that's happening at COP28. I'd like to move us along now. We have some wonderful speakers that will join us as part of a panel discussion. We have Gitindi Gatari, the CEO of AMREF, Health Africa and Strategic Advocacy Committee Chair. We'll also have Merit Kahil, who is the founder of Your Egyptian Doula and Knowledge and Evidence Synthesis Working Group Vice Chair under 30 for the PMNCH group, and Agnès Sousset, the Director of Health and Social Protection from the French Development Agency. I think we're going to start with Gitari, who has kindly sent us a video as he could not join us in person today.
Thank you for this opportunity to join this critical panel discussion on addressing the impact of climate change across the life course as we approach COP28. Climate change is indeed one of the biggest threats to women's, children's, and adolescents' health, and it is an intergenerational injustice. Women, children, and adolescents, especially those who are living in low and middle-income countries, humanitarian settings, marginalized conditions, or suffering various forms of discrimination, continue to bear the most consequences, with climate change acting as a threat multiplier to the existing socio-political and economic vulnerabilities. We must all acknowledge that not all bear the impacts of climate change equally. This is not therefore just an issue about health, it's about justice. It's about acknowledging that those who have contributed the least to climate change often experience the greatest burden of climate disasters, in a way saying that contributing little to climate change does not give you a discount on the impact of climate change. This COP marks a turning point, with the first ever Health Day, a climate and health ministerial, and an outcome declaration on health and climate change. It represents for us a unique opportunity to advance the health argument for climate action. Climate response policies and investments must prioritize women's, children's, and adolescents' health, accounting for their unique needs across their life course and placing their needs at the center of climate adaptation and disaster risk reduction strategies. In my capacity as co-chair of the PMNCH Strategy Advocacy Committee, I am delighted to announce that PMNCH is launching today an advocacy brief outlining actionable steps for different constituencies for all of us to foster collective efforts in addressing the climate threats to women's, children's, and adolescents' health. This brief and its recommendations offers a roadmap for action, stressing the need for inclusive, cross-sectoral responses and whole-of-government strategies. We must break silos between ministries and sectors and meaningfully engage women, children, and adolescents in a truly people-centered manner. Colleagues, time is running out. The current climate mitigation commitments set the world for 2.4 to 2.6 degrees centigrade warming above pre-industrial time by 2100. This rapidly closes the window to reach the Paris Agreement goals. Previous successes in reducing maternal mortality have stagnated due to external factors, contributing to instability and health system fragility. These include climate, public health threats like COVID-19, and humanitarian crises, and now the debt crisis that's affecting low and middle income economies. To achieve the SDGs, meet the targets of the Paris Agreement, and fulfill the objectives of the global strategy for women, children's, and adolescents' health, it is crucial to recognize the interconnectedness between climate change and women's, children's, and adolescents' health, while ensuring equity, saving lives, and securing a better and healthier future for all. I thank you all.
That was a great start to our discussion. Next, Merit, PMNCH has recently coordinated the Global Forum for Adolescents, also known as GFA, the world's largest ever gathering for adolescents' well-being, calling on governments and non-state actors to commit to the demands of and from adolescents. What were the young people engaged in the forum demanding on climate change, and what were those outcomes? Could you share that with us? Thanks.
Thank you very much, Doris. Greetings, colleagues. I want to ensure I'm audible. Good afternoon, good morning. My name is Mirat Khalil. I'm joining you here from Cairo, Egypt. And I want to take a moment and thank the organizing colleagues for really highlighting this critical intersection between climate change and the health of adolescents and young people. The esteemed speakers ahead of me really mentioned and highlighted the vast inequality and injustice, the fact that our generation and our younger peers who have contributed the least to the climate crisis are bearing one of the heaviest burdens. And Doris, you're right. Our generation has been at the forefront, issuing a loud cry for urgent, immediate, and effective climate action and accountability. Young people have been and will continue to scream for urgent climate action. Why? Quite simply, because we see our house is burning and we see that the response is not sufficient. The latest WHO UNICEF Lancet Commission stated that there is not a single country which provides the conditions to support children to live healthy lives today or an environment that's fit for their future. There's also evidence that notes that children born in 2020 will experience 7 times more extreme weather events than those born in the 1960s. Further to that, let's also consider that every young person that is alive currently on the planet has been exposed to at least one type of climate or environmental hazard or shock, including heat waves, cyclones, air pollution, flooding, and water scarcity. We also know that many of these vulnerable communities live at risk in multi-hazard environments. It's not just one, it's the accumulated effect of many. And we also know, as mentioned by the esteemed colleagues, that some of these climate emergencies have very immediate and very severe implications, not just on physical health outcomes, but also on mental health outcomes, especially for young people. The current generation of young people is the largest ever, with 1.8 billion young people between the ages of 10 to 24 worldwide. That's about a quarter of the world's population. And as mentioned, young people are disproportionately affected by the climate crisis. And not only have we been calling on our governments to commit to adolescent and young people's well-being within the context of climate change, but we're also calling for our own meaningful engagement within the response. We are critical and key stakeholders, and we should be part of co-creating the solution. I also want to point out the fact that only 27% of disaster risk reduction committees are youth sensitive. So don't take my word for it. Let's hear from what other young people have had to say. This October, just a month ago, in October 2023, the Global Forum for Adolescents saw the largest gathering focused on adolescent well-being, with upward of 200 partners and 9,000 participants from all around the world. This event amplified the voices and demands of millions of young people, presented the latest evidence on adolescent well-being, and called on governments to commit to action. Unsurprisingly, of course, climate change was a cross-cutting theme of the forum. And of course, it shouldn't come as a surprise that young people at the forum and beyond were demanding climate justice. So now I'd like to invite our colleague Caroline to share a video for us to hear what other young people, other young climate activists have had to say. Over to you, Caroline, for the video. Thank you.
$1.8 billion young people, including children and adolescents, are now shouldering the impacts of climate change on their lives and livelihoods.
The climate crisis is not just something far removed from us, it's also about us, about people and societal structures.
Change is already affecting our lives. And I think that's why this work is important now more than ever. Climate, reproductive health rights, adolescent girls' rights are all intersected, and we're not living single issue life.
Climate change, save our green earth space. Young minds can combine to save our race. The ecosystem is all at stake. Emissions from cars not giving us a break.
With self-serving goals, we need to involve more Malalas and Gretas, have policies shaped and led by Gen Z.
Thank you for showing that inspiring video. So to any and all colleagues on the call, especially young people who are a part of the conversation, who want to make your voice heard, I want to encourage you to check out the 1.8 billion campaign. And I will ask the colleagues to put the links in the chat for your ease of access. Doris and colleagues, as you saw from this video, one of the most powerful things about this forum is that it brought together young people, advocates, researchers, and decision makers all together to build the perfect equation: the data, the demands, and the decision makers. So I'd like to very briefly share with you some of the examples that we saw from the forum. First, the forum presented the latest evidence from the BMJ collection on adolescent well-being, which highlighted that climate change threatens all 5 domains of adolescent well-being: health and nutrition, connectedness, positive values and their contributions to society, safety and supportive environments, learning and education, and of course, their employability, and finally, agency and resilience. And you can read more very specifically about that link between climate change and those specific 5 domains. Secondly, the forum presented the demands of more than 1.2 million adolescents and young people between the ages of 10 to 24 from over 90 countries on what they wanted most for their health and well-being. In response, PMNCH and partners launched the Agenda for Action for Adolescents, a set of 7 asks which were co-developed by young people and partners from around the world to call on governments, partners, and of course, all other relevant stakeholders from across all sectors to prioritize what are some of the main actions that we need to take in order to prioritize and support adolescent well-being at national level. The Agenda for Action for Adolescents can also be found in the chat. And lastly, the forum wasn't just about voicing the demands and sharing the data. It was about action and accountability. It also brought the decision makers into the conversation. The forum showcased over 18 governments covering almost every WHO region who committed to more investments, better policies, and smarter programs aligned with these 7 asks to support adolescent health and well-being. As you saw from the video, one of the notable examples that we all collectively wish to commend was the government of Malawi, who have integrated climate change in their commitment to improve adolescent well-being. The government of Malawi has appealed to development partners to fulfill their pledges for climate financing to benefit more than 40% of adolescents in the country. They will also target 20% of climate disaster resilient infrastructure to serve the needs of adolescents. One example, to put it more pragmatically, is the construction of evacuation camps in climate disaster-prone areas to reduce the number of schools that need to be transformed into camps, particularly during climate disasters. This will help mitigate forcing adolescents out of school during emergencies and disasters. We want to take this moment to encourage other governments to take similar bold actions at the intersection of climate action and adolescent health and well-being. Here, we're calling on you to partner with us young people, not just to prioritize adolescents, but also to prioritize young people and all the future generations. Together, we can create a world where health and prosperity of the future generations are prioritized and safeguarded. Thank you, and back to you, Doris.
Thank you so much, Merit. And thank you for those compelling words that showed the great energy for our younger folks here. You mentioned climate financing, actually, and so I'd like to pass it over to Agnès Soukat, who's the Director of Health and Social Protection from the French Development Agency. Agnès, could you tell us how we might strategically leverage climate financing and health financing to ensure that climate and health initiatives synergize effectively for the benefit of women, children, and adolescents? Thanks for your thoughts on that, Agnès. Over to you.
Thank you so much. And thanks to Merit for her intervention and displaying what is most important in what we are collectively trying to do, which is this energizing collective action, the creation of a movement. And I think if I would have to say in a few words what is needed to mobilize financing, I would say exactly what Merit and the youth movement, adolescents movement is doing, which is to create a movement that fosters actions that benefit everybody, that fosters the production of global public good, the production of commons. Commons is what we can only do together. And a crisis like the climate crisis cannot be addressed by individuals. It cannot be addressed by markets. It's actually the failures of markets that got us to climate change by failing to account for the cost of environmental damage. So if we think about financing in relation to the women, children, and adolescent agenda, as well as the climate agenda, it is action that has to be collective, and collective means pooling resources, and it means taxation, and it means public money in support of public policies. So the power of this movement was displayed again in another forum that took place back in July, the One Sustainable Health Forum, OSH in short, that was organized by all the different foundations and civil society movement and researcher groups and international agencies that want to move on this agenda of investing in institutions, programs, activities that will help address the challenges of climate change, but more broadly, the challenges of environmental damage, because we know that these issues are intricate and that climate change, biodiversity losses, pollutions, or even issues such as antimicrobial resistance are all linked to the way human beings interact with nature. And what we realize, and especially that realization came during the COVID crisis as a kind of wake-up call on the global threats that we face from changes in the environment, in the kind of biological, chemical, physical threats that are surrounding us. We've realized that we need to work differently, and we need to work together to change the way resources are both used and are shared. We know now that climate change compounds the inequities that exist between countries, and that poor countries, developing countries, are the ones who bear and will bear a large part of the impact of climate change, while they actually did not contribute to carbon emissions very much. And that this addition to the inequalities that were pre-existing in the way the economy was working and left some countries behind on the pathway of growth, prosperity, and poverty reduction, that is really the challenge of our times. And the big question there is how to mobilize resources that are collective, because those resources need to support collective action. And what we've seen is maybe looking at this from just a business as usual perspective, thinking about how global health activities can access climate financing and how there can be more allocations of these climate resources in climate funds to the health sector and to health activities. But we would be really cutting ourselves very short if we would follow that path. The agenda is much larger than that. The resources needed are much larger than that, and the issues at stake are much larger than that. In fact, in many ways, there is no problem of resources. If we compare how much the world is spending on health today, which is about 9 trillion or 11% of global GDP, this actually compares to the subsidies that the world is giving to fossil fuel, the fossil fuel industry.
Sì, però non era da Agnès, era della former minister, di quella che Tedros ha cacciato via, che era la... Niente, 4 cosine, però niente grave. Hai visto questo email che sta circolando?
No. The subsidies to fossil fuel industry represent about 7% of these global GDP, which means that if fossil fuel subsidies were removed, this could mobilize about $6 trillion, which would be about 75% of what the world spends on health today. So the issue is not resources. In many ways, there are too many resources, too many financial resources going to the wrong agenda. And if we think about how to go about this financing agenda, certainly, first and foremost, we should establish review processes to examine the consistency of competing public subsidies and versus the health impact, the fuel subsidies versus the air pollution and its health impact, beet sugarcane production versus its health impact on diabetes treatments, high-story concrete buildings versus neurological disorders. We need to think about public subsidies broadly. Fuel subsidies first and foremost, but also agriculture subsidies and how they contribute to our food system and how this contributes to biodiversity loss and health impact, such as impact on diabetes and cardiovascular diseases. So overall, the recommendation of the One Sustainable Health Forum back in July that brought together many countries, including countries such as Bangladesh, Pakistan, Senegal, Lebanon, Brazil, as well as European countries, is that government should eliminate harmful subsidy mechanisms to reduce or suppress their adverse effect on environment, animal and human health, and the negative environmental impacts in support of what we should call a smart environment and health taxation for one sustainable health, for planetary health. So we should really think about implementing these taxes that are originally considered pertinent for environmental protection, such as carbon taxes, fossil fuel taxes, as transforming them as one sustainable health taxes, including fossil fuel and carbon taxes, addressing air pollution, addressing also intensive livestock, animal production and other pollution taxes, and first and foremost, including the elimination or exemption of taxes on fuel for the high consumption industries, such as the airline industries and the shipping industry. And it's already in discussion. The taxation of airline already exists in many countries, and the taxation of the shipping industry is under discussion. So implementing taxes to protect both health and the environment and have one sustainable health taxes, whether it is on tobacco, alcohol, sweetened beverages, or broadly sugar, together as taxes on environmental threats to health, should be at the front line of this agenda. The second element I would like to emphasize is the importance of public financing. Again, we're talking about the collective action. We're talking about the power of money that is pooled together for one common goal. And here we really have to go back to the question of where do governments invest their public funds, and thinking about what is the amount of public investments that is mobilized every year and where does it actually go. And we have one indication of that, which is the total investments of public development banks. And those public development banks, there are more than 500 of them. They include the World Bank, they include the regional banks and the multilateral development banks, but they also include national banks in every country, such as the Development Bank of South Africa or the Development Bank of Brazil. Together, these development banks mobilize every year more than 2.5 trillion of public investments. And that I'm saying trillions, and this is in comparison to overseas development for health, which at country level is about 16 billion and overall at about 25 billion. So this means that we have more than 10 times ODA today that could be mobilized for health if only 10% of public investments would be actually channeled to health. So that's really the second area in which we can mobilize financing for climate and health and for preventing the impact of that on women, children, and adolescents, is in making sure that collectively we make our governments accountable for investing smartly in the health sector and bringing the investments into the health sector to 10% of public investment, including investments in those very programs and institutions that address the question of climate and health, the question of planetary health.
Thank you so much.
And finally, and I will just conclude with that, the last point that was emphasized by all the participants of the forum was the need to invest in programs that channel resources to communities. We need multi-sectoral action. We need social protection and safety nets programs that support communities, that support families, that support women and children in the communities to respond to the extreme weather events, to respond to the what the climate is going to how climate is going to affect the environment, and develop their own community-anchored programs. Transferring funds to the front line will be essential in that agenda. Thank you very much.
Thank you so much, Agnes, for those words. And I think you've brought up some really important pieces on inequality and how financing overall is very much linked to health financing as well. Before I pass it over to Dr. Maria Nira, who is the Director of Environment and Climate Change and Health at WHO, I'd like to remind everybody that we do have the links for the 2 documents up now in the chat, and you'll see the call for action there, and you can also indicate your support for the call to action as well. I'd like to pass it to Dr. Maria Nira, who can give us some closing words and reflections on this webinar, as we were so gracious and proud to launch these 2 documents with you. Over to you, Dr. Nira, and thank you.
Thank you very much, and really apologies for not being with you at the beginning. Times are really hectic because of the COP28, as you know, which is very good because it means that the interest is really growing and hopefully in the right direction, or at least this is what we are trying to do. I've been following the presentation and I would like to congratulate all of those involved. I think all the interventions are extremely relevant on enforcing this message that climate change is affecting all of us, is affecting the health of everyone, but there are people who are more vulnerable than others. There are groups like women, children that are more vulnerable than others, and therefore we need to make sure that we pass that message. Let me just concentrate a few minutes to tell you what we are trying to put at the center of the COP28. As you know, it took us at least 10 years, at least 10 years to make sure that we have a health day at COP. It has not been easy. Many of you pushing for this agenda, they know that at the COPs on climate change, health has always been considered as an important issue, but always not part of the critical negotiations or not sufficiently recognized. So this year, for the first time ever, we have a health day. Is this enough? No, this is an historic thing. We are making sure that the voice of the health community will be there. We will make sure that there will be a legacy. We will make sure that the countries sign the Declaration on Climate Change and Health that themselves they did, but we want countries to go farther and be even more ambitious and go beyond. So you heard climate change is affecting the health of all of us, infectious diseases, non-communicable diseases, mental health, of course, heat waves, malnutrition, displacement, everything. And because of that, we need to go to COP to ask three things. One, to make sure that anyone at the negotiation table at the COP, no country could be able to say, I didn't know. I didn't have enough evidence, or you didn't provide me all the science. No way, no excuses. That will be the first thing. We need to make sure that the voice of the health community, all of you, of course, included, is heard, and nobody will be able to use any excuse on saying we didn't know. Second, we need to make sure that our health systems become climate resilient and become low carbon, and they are better prepared to respond to the incredible shock that many countries are already facing related to the increase of certain diseases and the damage that climate change is causing on our population. So adapting the health systems, and for that, and this is number three, we need finance. And my friend Agnieszka was describing very well the issues. Only if the countries stop it to give subsidies to fossil fuels, it will be enough to pay what we need to do in terms of adapting our health systems. The other point that we want to raise at COP is the fact that to stop all of this, we need to go at the causes of, and the causes of the climate change and the causes of air pollution, which is killing 7 million every year, are overlapping and are related to the combustion of fossil fuels. So we need to make sure that our voice about stopping this dependence on fossil fuels, this kind of sabotage, as Dr. Tedros will call it, needs to stop. And then to finalize with a positive message, we need to put on the table all the health fantastic, enormous co-benefits that can be obtained, or directly health benefits that can be obtained if we reduce air pollution coming from accelerating transition to renewable sources of energy. If we move on sustainable, healthy diets, we can reduce as well by more than 5 million every year. And if we move to a healthy urban planning, particularly related to sustainable transport at the urban level, at the city level. With all of those arguments, we need to be, all of us, aligned. Those working on maternal health, on children, on everything, please sign the petition by WHO. I'm sure that you all saw it. It's United for Climate Change and Health. And if you don't have it, I can send it to you, and please disseminate among your groups, because we want to arrive at COP with the voice of millions of health professionals backing us, and then at the ministerial, where we will have the voice of the ministers of health. We want to make sure that we will be supported by the voice of all millions of people who are telling us this is affecting our health and we need to react. But we need to close the tap as well. We need to close those emissions. We need to reduce emissions. And then the benefits will be for all of us, for children, for adolescents, for women, for maternal. Another thing that I wanted to mention is many of you heard about the health pavilion. There will be many activities and there will be visibility for all of those programs. But in addition to that, we will have a little healthcare facility in the middle of the COP with solar panels on the roof. And this is a contribution to maternal health, to children's health, because sub-Saharan healthcare facilities, they do not have access to electricity. And because they do not have access to electricity, of course, they do not contribute to the carbon footprint, but they cannot perform the interventions in terms of health. And mothers that are about to deliver are the most affected. So we need to have those electrification with solar panels of healthcare facilities, particularly in Africa. And I invite you all to visit that. I think I need to stop here. I see your faces and your body language, but thank you for the opportunity. Bravo, everyone. And please, let's move on the same strategic direction and align as one community on health. Whoever is affected, those are the things we need to do all together. Thank you so much. We can hear you.
Thank you. Thank you so much, Dr. Nira. And thank you so much to all of our speakers, His Excellency from Equatorial Guinea, our colleagues from UNICEF and UNFPA, Abid and Will, respectively, Gitanji Katari, Merit Kalhil, and Yanya Sukat, and of course, Dr. Nira. Thank you so very much. Thank you to all the colleagues. Please do go to the websites to see the places where you can make your endorsements and your pledges for maternal newborn child health and protecting their health from the effects of climate change. Thank you all and have a lovely day. Bye-bye now.